Here we have MRI of the lumbosacral spine in 35-year-old with history of low back pain and bilateral sciatica. On this MRI, what we got here is these anterior osteophytes which show increased signal intensity on both T1 and T2. There is also mild thickening of the anterior longitudinal ligament. We do not have any stir sequence to assess if there is any shiny corner or edema at the corners. If we look carefully on the axial sequences, we've got moderate osteoarthritis of the facet joints, which is unusual for this age group. And also, you can see there is hypertrophy of the ligamentum flavum. The discs appear more or less unremarkable with tiny disc bulge at L4-5, but there is no evidence of annular fissuring or protrusion. At L4-5, you can see on the sagittal there is lack of CSF and crowding of the nerve roots, and same thing is much better appreciated on the axial sequence where there is hardly any CSF within the thecal sac. If you compare the thecal sac here above, there is good amount of bright signal which is CSF. As I come lower down, there is a good amount of CSF and the nerve roots are seen nicely hanging away from each other. But at this level, there is no CSF and all the nerves are crowded. So this one is moderate to significant crowding of the nerve roots. This is secondary predominantly to moderate facet joint arthritis and ligamentum flavum hypertrophy with mild disc bulge. So this disc this spinal canal problem is secondary to combination of these three elements, and it is important to document that in the report and also raise the suspicion of inflammatory spondyloarthropathy for which a sagittal stir sequence of the thoracolumbar spine and MRI of the sacroiliac joint is recommended.